Hello everyone, let's dive into some CPC exam practice questions focusing on the digestive system. Let's begin. First question, the splenic, that is left colic flexure, lies in the upper left quadrant between what two portions of the large intestine? Option A, cecum and ascending colon. Option B, the descending and sigmoid colon. Option C, the transverse and descending colon. Option D, the ascending and transverse colon. In your ICT manual, in anatomical illustrations, you can find the diagram of digestive system, large intestine anatomy. You can see that the left colic flexure, that is splenic flexure, it lies in between transverse colon and descending colon. So, the right answer will be option C, the transverse and descending colon. Next question. A surgical procedure that creates an opening into the jejunum is defined as a option A, colostomy, option B, gastrojejunostomy, option C, gastroenterostomy, option D, jejunostomy. So what is the right answer? The right answer is jejunostomy. Option D. An ostomy means operation to create an opening from the area inside the body to the outside. A procedure that creates opening into jejunum is defined as jejunostomy. Next question. This question is from tonsillectomy and adenoidectomy. In the previous video, I have explained guidelines related to this and also other guidelines related to digestive system. You can check the playlist CPC Exam Digestive System series, and also don't forget to like and share this video and subscribe to Codement Mastery. Read the question. A 15-year-old female is to have tonsillectomy performed for chronic tonsillitis and hypertrophied tonsils. A mouth gag was put in place and the tongue was depressed. The nasopharynx was digitalized. No significant adenoid tissue was felt. The tonsils were then removed bilaterally by dissection. The uvula was a huge size because of the edema. A part of this was removed and the raw surface oversewn. So which CPT code is reported? Check option A, 42821. 42821 is for tonsillectomy and adenoidectomy, age 12 or over. In this scenario, the age of the patient is 15-year-old. But the code 42821 is for tonsillectomy and adenoidectomy. In the scenario, the patient is to have a tonsillectomy performed, not adenoidectomy. So we cannot code 42821, which is for tonsillectomy and adenoidectomy. So eliminate option A. Coming to option B, 42825, that is for tonsillectomy, primary or secondary, younger than age 12. In the scenario, there is tonsillectomy performed and the age of the patient is 15-year-old. But 42825 is for younger than age 12. So we cannot use 42825. We'll eliminate option B. If one code is wrong, the entire option will be wrong. Now check option C, 42826, that is for tonsillectomy, primary or secondary, age 12 or over. So in the scenario, there is tonsillectomy and the age of the patient is 15 years old. So that is exactly matching with the code 42826. So the right answer will be option C. We'll eliminate option D, 42842, because that is for radical resection of tonsil. In the scenario, anywhere they have not mentioned radical resection of tonsil, right? So we'll eliminate option D. In option C, there is another code 42106. Check the code. That is for excision lesion of palate uvula with simple primary closure. In the scenario, you can see they have mentioned the uvula was a huge size because of edema. A part of this was removed and the raw surface was sewn with 3:0 chromic catgut. So it is excision lesion of palate uvula with simple primary closure. So 42106 is the right code. They have appended modifier 51, that is for multiple procedure, because in the scenario there is tonsillectomy done and also the uvula was excised with simple primary closure. So the right answer is option C. Next question. This is also related to tonsillectomy and adenoidectomy. 8-year-old female presents to same-day surgery unit for a tonsillectomy. During the surgery, the physician notices the adenoids are very inflamed and must be taken out as well. The adenoids, although not planned for removal, are also removed at the same surgery as the tonsillectomy. What CPT codes are reported? Check option A, 42820. 42820 is for tonsillectomy and adenoidectomy younger than age 12. In this scenario, there is tonsillectomy and also adenoidectomy, because they have mentioned the adenoids, although not planned for removal, are also removed. So adenoidectomy is also taking place. So we have to code for tonsillectomy and adenoidectomy, and the age of the patient is 8 years old. So that is younger than age 12. So 42820 is matching. So option A is the right answer. Let us check other options also. Check option B, 42821, that is for tonsillectomy and adenoidectomy age 12 or older. But in the scenario, the age of the patient is younger than age 12, right? So we'll eliminate option B. And in option C, there is 42835 and 42830. 42835 is for adenoidectomy secondary younger than age 12, and 42830 is for adenoidectomy primary younger than age 12. But in the scenario, they are performing tonsillectomy and adenoidectomy. Okay, so we cannot code adenoidectomy separately because we have a combination code. So eliminate option C. And in option D, 42825 is for tonsillectomy primary or secondary younger than age 12, and 42835 is for adenoidectomy secondary younger than age 12. So they have listed separately tonsillectomy and adenoidectomy. But remember, we have a combination code. In CPT coding, whenever there is a combination code available, we should never use separate codes. Okay, so eliminate option D. Next question. Read the question. A 35-year-old male has internal hemorrhoids and has elected to have them removed. The ligator and alligator forceps have been inserted through an anoscope. The physician identifies the most prominent hemorrhoid and ligates it at the base with a rubber band. Which CPT code should be used? Check option A, 46250. 46250 is for hemorrhoidectomy external 2 or more columns or groups. 46945 in option B is for hemorrhoidectomy internal by ligation other than rubber band single hemorrhoid column without imaging guidance. And check option C, 46255, which is for hemorrhoidectomy internal and external single column group. And check option D, 46221, that is for hemorrhoidectomy internal by rubber band ligation. In the scenario, they have mentioned the physician identifies the most prominent hemorrhoid and ligates it at the base with the rubber band. So which among these 4 codes is the right answer? If you choose 46221, then you are absolutely right, because the code 46221 is for hemorrhoidectomy internal by rubber band ligation, which is mentioned in the question. So option D is the right answer. We'll eliminate option A, 46250, because that is for hemorrhoidectomy external 2 or more columns. That is not matching with the scenario. So eliminate option A, and option B, 46945, is for hemorrhoidectomy internal by ligation other than rubber band. But in the scenario, there is ligation with rubber band. So eliminate option B. And option C, 46255, is for hemorrhoidectomy internal and external single column group. That is also not matching with the scenario. So eliminate option C. Option D is the right answer. Let us move on to the next question. Catherine had a hernioplasty to repair a recurrent ventral incarcerated hernia. Recurrent ventral incarcerated hernia, I'll highlight the main terms, with implantation of mesh for closure. The surgeon completed debridement for necrotizing soft tissue due to infection. What code would you use for this procedure? In option A, the code 49614 is for repair of anterior abdominal hernia, that is epigastric incisional ventral. In the scenario, they have mentioned ventral, so that is matching, and it is recurrent, that is also matching, and it is incarcerated. So 49614 is for incarcerated or strangulated, that is also matching. And there is also implantation of mesh. In the code you can check, they have mentioned including implantation of mesh. So that is also matching. So the right code will be 49614. We'll check why other options are wrong. Check 49613, that is for repair of anterior abdominal hernia, that is epigastric incisional ventral, recurrent, including implantation of mesh. That is right, but it is for reducible. Okay, in the scenario they have mentioned incarcerated. So 49614 is for incarcerated, that is correct. 49613 is for reducible, that will be wrong. So eliminate option B. In option C, the code 49592 is for repair of anterior abdominal hernia, initial. Okay. But in the scenario, they have mentioned recurrent. So we have to code appropriately. We cannot use the code for initial, which is 49592. So eliminate option C. Coming to option D, 49591, that is also for initial. So that will also be wrong. In option A, they have mentioned another code, that is 11005, that is for debridement of skin, muscle and fascia for necrotizing soft tissue infection, abdominal wall. In the scenario, you can see they have mentioned the surgeon completed debridement for necrotizing soft tissue due to infection. So 11005 is the right code. And they have appended modifier 51, that is for multiple procedures. In this scenario, you can see there is hernia repair and also debridement for necrotizing soft tissue due to infection. So we are using modifier 51 to denote multiple procedures. Option A is the right answer. So that's it for today. In the next video, we'll solve some more CPC exam practice questions related to digestive system. So stay tuned.